Okay, so these are your controlled articular ranges of motion, or your joint articulations, joint mobility, joint moves. The purpose of this is just kind of warm your joints up, start driving that blood flow and get fresh nutrients into the tissue so we can start rebuilding new tissue as well and create new ranges of motion as we progress. So, a couple things. You just want to start head to toe, toe to head, whichever, shoulders. You can start however, and just make sure you do them on a daily basis or multiple times a day. Just a few ranges of motion. You don't have to do 10 repetitions or 20 repetitions because you're going to fatigue out. So let's start with just 3 to 5 really good articulations just so we can ensure really good movement and deliberate movement. From there, we're just going to do the total body routine and then start your 2-minute drill of warming up with some stretches, and we'll get into that after this. So for now, let's start with the cervical spine, and then we'll kind of break our way down, and these should only take a couple minutes every single day. So let's start with our cervical spine. So you're just going to picture a pencil on top of your head, and we're just going to draw a big circle on the ceiling as we can. So if you feel any pain or discomfort, just take mental notes, and don't force yourself through pain. Just kind of, if you get a pain right here, and pain can be pretty relative, so if you feel like a click, a pop, or a strain out here we kind of expect on that opening angle. Closing angle pain on this side, we don't necessarily want that. It might mean there's some degeneration there, so keep that head out of that pain segment, kind of skip it, and then continue on your circle. So don't just do head circles. Really train that tissue and force it, gently force it into an end range, and then continue on and keep an end range in a deliberate movement all the way around. Again, only 3 to 5 circles to start, keeping your body rigid so we get true cervical rotation, and we're not moving our whole body to compensate and move our spine. So stay here, and then we'll switch the other direction. I'm just trying to get your ear like we're talking on the phone. And again, take a mental checklist of what is going on your neck. From there, let's do a full spine. So we'll do flexion, extension, and a little bit of rotation on the spine here. So you're just going to forward fold, just nice and gently, and then you're just going to kink to your left or right, getting a nice bend in your spine, opening up the rib cage here, reaching behind you and still coming up, reaching your hands behind you, nice relaxed arms, float, and then reach behind you and extend your spine, rotate a little bit, opening up the side of your rib cage, coming down, still reaching behind you, and sweep back around, and then we'll switch directions, kink to the right, force yourself up, reaching, and back around. And again, 2 or 3, 5 each side. You can alternate or stick to the same side. Okay, now for the hips, you're going to lift that leg up. I'm going to barn door this leg as far as you can without compensating and letting your body turn. Pulling that leg open with that glute, your knee nice and tight, picturing like a glass, tipping over and pouring something out, getting that internal rotation, sweep that hip around, and then back to the front, and then reversing that, come back, extend the hip a little bit, barn door and open up that hip, flex as high as you can, and drop that guy back down. So again, working that hip joint in there, forcing that new range of motion. Lots of blood, lots of new tissue, and just kind of prepping your joints for movement. From there, let's go into we'll come up a little bit, go into our shoulders. So you're going to reach out like you're just shaking someone's hand. You're going to flex that shoulder up. It's going to stop eventually, again, locking in your whole body so you're not compensating. When you get to that end point of your shoulder, reach up and rotate your whole arm and continue that circle back. And then do the exact opposite and reverse that circumference. Reach back, it'll stop again. Rotate that whole arm. Reach and bring it back around and shake the hand. Should be nice and smooth. If you want to kind of test yourself, you can go closer to a wall and give yourself like a tangible object to pull away, so you're giving yourself a nice hard pull around and teaching your tissue to pull into a new end range and opening up that joint and making it move properly. From there we can go into scapula, so our shoulder blades moving on the rib cage. And now I like to picture this one, picture like a train wheel and the arms on the train wheels there. So just going to reach out again like you're shaking someone's hand. You're going to pull your shoulder blade back. Again, try not to compensate by arching your back and falsely doing scapular retraction. You're going to shrug up and then pushing forward and dropping that scapula back down. Notice my arm is moving with the scapula. It's not bending or moving on its own. It's moving with my scapula there. So 3 forward and then 3 backwards. Over exaggerating that movement, telling your scapula you really like these new ranges of motion. So from the back here, and again, these joints moving independently is what we want. We don't want a joint coupling and having the shoulder move the scapulothoracic joint. We want 2 joints here, not just one. And all of these we want joint independence before we can create joint interdependence and have everything move independently, and have each joint being a true joint, a true knee joint, a true hip, a true ankle, true shoulder. So we can create better ranges of motion and better joint health. From there, we're going to go into a rocking. I'm going to build more off of this later, but this is just to get your knee used to being in a flex position. So we're just going to go into a quadruped position, and what I'm going to do is hands right below your shoulders, about shoulder width apart, knees right below your hips, about hip width apart, toes tucked under. You're just going to look straight ahead and keep your hips nice and flat. And we're just going to gently rock back and forth. Here I just want you to play with the range of motion. So you might get stuck right here with your knee flexion. So just hang out here. You can move your knee around. You can play with knee angles. You can play with ankle angles. We'll get into that later. But for right now, just rock back and forth, keeping a nice neutral spine. And again, just looks just like a squat. So we're just warming up and teaching that tissue how we want it to move.